Hi, I'm Christina, your physical therapist for today. What's your name, sir?
James Reed.
Okay, so Sir James Reed, today we're going to do manual muscle testing.
So, assuming po that I already get your vital signs and they are within normal limits, and na-perform ko na rin po yung aseptic technique, so we'll proceed na po sa ating MMT. So, MMT will involve touching several parts of your face. Will that be okay with you, sir?
Okay.
We're going to do manual muscle testing of the extraocular muscles. Criteria for grading extraocular muscles. Functional, immediate tracking in a smooth motion over the full range. Completes full excursion of the test movement. Weak functional and non-functional, not possible to distinguish accurately from the grade F or grade 0 without detailed diplopia testing. 0. Tracking motion in a given test is absent.
So first, we're going to test rectus superior muscle. The primary movement of this muscle is elevation of the eyeball. So the patient head and eyeball should be in a neutral alignment, looking straight ahead at therapist finger to start. Okay, sir, look at this pencil. So the head must remain static. Put your hand in, okay. So followed my pencil, the motion of my pencil, okay. There. Okay. Next, we're going to check the rectus inferior and the obliquus superior. The primary motion of those muscles is depression of the eye. To test, we're going to test each eye separately. So, sir, can you put again the... Okay. Please follow my pencil. Next is, we're going to check rectus medialis muscle. The primary motion of this muscle is adduction of the eyeball. Sir, please follow the movement of my pencil. Next is rectus lateralis muscle. The primary movement of this muscle is abduction of the eyeball. Okay. So, sir, please follow the motion of my pencil. Again. Next is obliquus inferior muscle. The primary motion of the obliquus inferior muscle is elevation of the eye, particularly from adduction. So, sir, follow my pencil. Okay, now, ma'am, I want you to follow my finger, but now, we're not going to close any of your eyes. Do you follow, ma'am? Okay, so 1, 2, 3, 4. Okay, thank you, ma'am. Levator palpebrae superioris muscle. Primary motion is opening the eye by raising the upper eyelid. The patient should open and close the eye with and without resistance. So, sir, can you open and close your eyes? Okay. To test, patient attempts to keep the eyelids open against the manual resistance.
Criteria for grading levator palpebrae superioris MMT. Functional, completes normal range of motion and holds against therapist's slight manual resistance. Weak functional, can open eye but only partially uncovers the iris and takes no resistance. Patients may alternately open and close the lids, but excursion is small. The frontalis muscle also may contract as the patient attempts to open the eye. Non-functional, unable to open the eye and the iris is almost completely covered. 0. No eyelid opening.
1001, 1002, 1003, 1004, 1005. To test orbicularis oculi, observe the patient opening and closing the eyes voluntarily. So, sir, can you open and close your eyes? Okay. Now, let the patient and ask the patient to close and open each eye. So, sir, can you open and close your left eye? Okay. So, do it again in your right eye. Okay. So, now, ask the patient to close the eyes tightly. So, sir, can you close your eyes tightly? Open it. Okay. So, can you do it again, but each eye? So, first, let me do it in left eye. Close it tightly. Okay, open. Next, the right eye. Close, open. Okay, now, sir, close your eyes tightly. I'll put resistance. So, sir, don't let me open your eyes. 1001, 1002, 1003, 1004, 1005. To test corrugator superciliary muscle, ask the patient to frown. The eyebrows are drawn down and together. So, sir, can you frown?
For manual resistance, the therapist uses the thumb of each hand placed gently at the nasal end of each eyebrow and attempts to move the eyebrows apart.
Okay. So, don't let me erase it. Okay, 1001, 1002, 1003, 1004, 1005. Yan. Ulit. Frown ka. Frown. 1001, 1002, 1003, 1004, 1005. To test occipitofrontalis muscle, ask the patient to create an expression of surprise. So, sir, can you raise your eyebrows as high as you can? Okay. So, put resistant. Don't let me pull them down. So, 1001, 1002, 1003, 1004, 1005. Ulit. 1001, 1002, 1003, 1004, 1005.
So, ang gagawin po natin ngayon is manual muscle testing po ng nose. Specifically po yung procerus. Tapos, bago po tayo mag-start, ipoposition po muna natin si patient ng nakaupo. Then, i-instruct po natin si patient na i-wrinkle po yung nose niya. So, sir, can you do it? Tapos, gamit po yung dalawang thumb ko. I-place ko po siya sa bridge ng nose, then i-resist ko pa lateral. So, sir, gawin mo lang po ulit. 1, 2, 3, 4, 5. If meron po kayo nakitang prominent crest, and if the patient was able to tolerate some resistance, yung muscle gauge po is functional. Tapos, sir, gawin mo lang po ulit. Tapos, if may nakita po kayong shallow crest naman po, and the patient yields any resistance, the muscle gauge po is weak functional. So, sir, gawin mo lang po ulit yung ano. If the motion naman po is barely hindi po ganong magawa, then yung muscle gauge po is non-functional lang. So, 0 po if hindi po talaga nagawa ni patient.
Now po, let's proceed to our muscles of mastication, particularly first on your lateral pterygoid. So, here po, sir, is i-open nyo lang po yung mouth nyo. Then, after that is, magbibigay po ako ng minimal resistance, where as you open your mouth po is, itatry ko po itong i-close by giving a resistance po paakyat. Then, next po is maximal resistance naman po ibibigay ko. Okay. Gets naman po ba?
Mm-hmm.
Okay. Okay, so retry nyo po i-open. Okay. Then, bibigay na po ako ng maximal resistance. Okay, thank thank you po. Since you completed the full range of motion po and na-resist nyo na po, na-resist nyo po yung maximal resistance, then your grade is functional po. Then pag yung minimal resistance lang naman po ang na-resist nyo, it's weak functional po. Then non-functional if hindi mo talaga na-resist yung resistance na binigay ko. And lastly is zero or absent if hindi nyo po na-open yung mouth nyo. So next naman po is your masseter temporalis and your medial pterygoid, where dito naman po is naka-close po yung mouth nyo. And then as you close your mouth, I will try to open it by giving a resistance. Same lang po sa ating first na ginawa. First is minimal resistance, then after that is maximal resistance naman po. Gets naman po. Okay, proceed na po tayo. Okay sir, magbibigay na po ako minimal resistance. Then maximal resistance po. Thank you. Since na-resist nyo naman po yung maximal resistance and naka-close po yung mouth nyo, your grade is functional. Pag minimal resistance lang po ang na-resist nyo, then naka-close naman po yung mouth, it is weak functional. Then if naka-close yung mouth nyo, pero di nyo po na-tolerate yung resistance na binigay ko, it's non-functional. Then zero or absent if hindi nyo po na-close yung mouth nyo and wala pong resistance na na-tolerate. Okay, next naman po is your lateral and medial pterygoid, where dito naman po is i-move nyo po sideways yung inyong jaw as I put a resistance po sa side ng inyong chin. So, katulad lang din po ng first is magbibigay po ako ng minimal resistance, then maximal resistance po. Gets naman po ba? Okay, sir. Wait. Minimal resistance po. Then maximal. Okay. Since na-tolerate nyo naman po yung maximal resistance, then your grade is functional. If yung minimal resistance lang po ang inyong na-tolerate, it is weak functional. Then non-functional naman po if hindi nyo po there's a minimal deviation or yung pag-side po ng inyong jaw and wala po kayong na-tolerate na resistance. Then absent naman po or zero if hindi nyo po na-deviate at all ang inyong jaw. Last po for ating medial and lateral pterygoid. So dito po sir is itatry nyo po i-push ang jaw nyo forward. Then I will try to put a resistance backward. So same lang po sa ating mga first na ginawa is first minimal resistance, then maximal resistance. Gets naman po ba? Okay sir. Sige, try nyo po i-push. Okay, magbibigay na po ako minimal resistance. Maximal. Okay po. So, since na-tolerate nyo naman po yung maximal resistance, and there's a sufficient gap between your teeth, then your grade is functional. Weak functional naman po if minimal resistance lang yung na-tolerate nyo and there's no gap between your teeth. Then non-functional naman po if there's a minimal motion pero wala po kayong resistance na na-tolerate. Then lastly, zero or absent naman po if there's no motion and wala po kayong resistance na na-tolerate.
Okay, ngayon po, ang gagawin naman po natin ngayon is manual testing po. Manual muscle testing po ng tongue nyo po. So, ang una po muna natin gagawin is tongue protrusion. Ang muscle po nito is genioglossus and posterior fibers po. So, una po natin gagawin is po-position po natin si patient na nakaupo. Then, instruct po natin si patient na ilabas po yung dila. Yan, yung ganyan. Then, gamit po ng tongue blade, i-resist ko po yung dila nyo. Papasok, huwag nyo pong hayaang may pasok ko. Okay. So, sige sir. Two, three, four, five. So, functional po to if the patient tongue extends considerably beyond the lips. So, sir, gawin mo lang po ulit yung motion na ginawa ko. Yan. Tapos, isa pa po, sir. Yan. So, if the patient tongue reaches the margin of the lips, ang muscle grade niya po is weak functional lang po. So, sir, gawin mo lang po ulit. So, if the patient tongue does minimal protrusion and does not clear the mouth, ang muscle grade niya po is non-functional. So, zero po yung grade niya if hindi niya po nagawa. Ang susunod naman po natin gagawin is manual muscle testing po ng tongue deviation. Ang muscle po nito is genioglossus and other muscles. So, same position po ng patient. Instruct lang po natin si patient na ilabas po ulit yung dila. Then, i-move niya pa right. So, sir, gawin niyo lang po. Tapos, magre-resist po ako sa opposite side. So, sir, gawin mo lang po ulit. 2, 3, 4, 5. Sa kabila naman po, sir. 1, 2, 3, 4, 5. So, if the patient tongue reaches some part of the cheek or lateral sulcus, functional po yon. So, sir, gawin mo lang po ulit. Yan. Yan. Okay. Tapos, if the patient tongue naman po reaches corner of the lips or the mouth, the muscle grade po is weak functional. So, sir, gawin mo lang po ulit yung motion kong tinuro ko. Yan. So, if the tongue of the patient provides and deviate slightly to side, non-functional po yon, yung grade po ng muscle. Then 0 po if hindi niya po talaga nagawa. So, ang susunod naman po natin gagawin is your tongue retraction. Ang muscle po nito is genioglossus, anterior fibers, and xyloglossus. So, yun, same position po rin po ng patient. Then, i-instruct po natin. Sabihin po natin kay patient, hawakan po natin yung dila dito. Then, ang instruction po natin kay patient is, ilabas mo lang po yung dila nyo. Yan. So, gamit po yung gasa. Yan, gamit po yung gasa. Sir, hatakin ko po yung dila nyo palabas. Ipasok nyo lang po yung huwag nyo po hayang hatakin ko palabas. Okay? So, functional po yon if the tongue return to the rest position of the mouth of the patient against resistance. So, sir, gawin nyo lang po ulit yung motion. Hatakin ko po ulit, sir. Huwag nyo po hayaang hatakin ko palabas. Okay. Tapos, weak functional naman po if the tongue of the patient returns to the rest position but slightly resistance lang po yung ginawa. So, sir, gawin nyo lang po ulit yung Yan. So, The muscle gate po will be non-functional if the tongue tolerates no resistance and retract dahan-dahan. Okay. So, magiging grade 0 po to if hindi niya po talaga nagawa. So, ang susunod naman po natin itetest is yung elevation po of the tongue. And ang muscle po nito is palatoglossus and styloglossus. So, una po is instruct po natin si patient na i-open po yung bibig. Then, i-place ko po yung tongue blade sa harapan ng dila. Then, nag-a-apply po ako ng resistance pababa tsaka papasok. So, sige po sir, gawin po natin. One, two, 3, 4, 5. Okay. So if the patient tongue rises to the superior rises so that the superior reaches to the hard palate against considerable resistance, the muscle gate po will be functional. So sir, gawin lang po ulit natin. One, two, 3, 4, 5. Okay. So, if the tongue of the patient naman po reach the hard palate, pero may slight resistance lang po, the muscle gate po will be weak functional. So, ngayon po sir, gawin mo lang po ulit yung ano. So, if the tongue of the patient moves towards the palate but does not include pharynx, then the muscle gate po is non-functional. And pagka hindi niya po nagawa totally, 0 po yung grade. So, ang huli natin itetest is ang tipping of the tongue. And ang muscle po nito is superior and inferior longitudinal. Instruct lang po natin si patient na to touch the above of your upper lips using your tongue. So sir, can you So, if the tongue of the patient protrude and touches the area between upper lip and nasal septum, the muscle gate will be functional. Sir, can you do the motion again? So, if the tongue of the patient protrudes and curls but does not reach philtrum, the muscle gate will be weak functional. So, 0 po if hindi po nagawa ni patient yung movement.
So now, let's move on to the muscles of palate. So first po is particularly your tensor and levator belli palatini, your palatoglossus, and your musculus oculi. So first nyo lang po na gagawin sir is mag-a lang po kayo in your soprano voice or your high pitch tone voice. So gets naman po ba yung gagawin? Okay, sir. Then, titignan ko po yung loob ng mouth niyo. Okay, sir. 1, 2, 3, go. Okay, then since nag-move naman po ang inyong uvula along the midline and yung palatoglossal and palatopharyngeal arcs nyo is elevated and adducted to narrow the fauces, then your grade is functional. Then, weak functional naman po if nag-deviate yung inyong uvula on the side and then slightly elevated lang po yung arcs and they are asymmetrical. Then non-functional naman po if imperceptible yung movement ng inyong ovula and ng arcs, and then 0 or absent if there's no motion at all. So, our last MMT is your palatopharyngeus. So, dito po sir is ibublow nyo lang po yung finger ko. Then, maglalagay po ako ng mirror right above your upper lip to check leakage of air to your nose. So, okay po. Wait lang. So, okay. 1, 2, 3, blow. Ito ba po? Okay. So, since there's no clouding happened in the mirror, then your grade is functional. Pag meron naman pong slight or minimal clouding sa mirror, your grade is weak functional, and then 0 or absent if there's a heavy clouding in the mirror.
So now we will test the lip closing, which is orbicularis oris. Sir, ang gagawin lang po natin is i-compress po natin yung lips and ipuprotrude like parang nakanguso po, ganun. Okay po, so now to test your lip closing, mag-apply po tayo ng resistance and gagamit po tayo ng tongue blade. So sir, pagawa lang po din ng motion. Okay po. So, if the patient perform completely seal the lips and hold against the resistance, it is functional. And for the weak naman po, sige po, close po natin yung lips and po natin. So for the weak, the patient closes the lips but it is unable to take resistance. And for non-functional naman po, ganun. Yan. So for non-functional, it has some lip movement but it is unable to bring lips together. And for 0 naman po, there's no closure of the lips. So now, we will do the cheek compression, which targeting your buccinator muscle. So, the patient will compress the cheeks bilaterally by drawing them into the mouth. So, ang gagawin lang po natin, sir, is parang ganito lang po. Okay. So, ngayon po, mag-a-apply po tayo ng resistance. Gamit po tayo ng tongue blade or tongue depressor. So, for functional, okay po. Sige, bigyan mo siya ng po ulit. Sige po. 2, 3, 4, 5. Okay po. So, for functional, the patient performs movement correctly and holds again strong resistance. And for weak functional naman po, sige po. Gawin po. Okay, so the patient perform movement but it is unable to hold against any resistance. And if it's non-functional naman po, there is some movement, detectable movement but not complete. And for 0 naman po is no motion of cheeks, and yun lang po.
Assuming po that I already got your vital signs and they are within normal units and nakapag-perform na po ako ulit ng aseptic technique, then done na po tayo sa ating assessment. I'll see you next week po. Thank you!